Good afternoon, everyone. Welcome to the Wellness Gala Plus. Welcome, welcome, welcome. My name is Dr. Jennifer Jeanty. I am a functional medicine practitioner, and I am a proud owner of Wellness Corner NJ. I would like to take this opportunity to thank Debbie Peterson for having such a wonderful platform for practitioners like myself to come in here to offer education to you guys, information to help jumpstart your healing journey. Today, I will be presenting on the difference between a functional blood work and a conventional blood work. First, let me tell you a little bit about myself. I am a functional medicine practitioner. Like I mentioned earlier, I own a clinic in Denville, New Jersey called Wellness Corner NJ. I help support two different types of patients. One with digestive system, anywhere from chronic constipation, gas bloating, chronic fatigue, to Crohn's colitis. And another population, cancer patients. I help them treat cancer and support them throughout the cancer journey. However, the foundation of both programs is IV vitamin therapy, because I believe that IV vitamin therapy is the future of medicine. I am a big believer in blood work because I know that we need to test and not guess. That is why I'm so honored to be here and showcase the blood work that I will be discussing today. So, what is the difference between a conventional blood work and a functional blood work? And I also brought some example for you guys too as well, because I am a physical learner, so it is awesome to show you some pictures and some examples so you can get a better understanding of what I'm referring to at conventional blood work or functional blood work. So when you go to mainstream medicine and you go to your primary care doctor, your cardiologist, your neurologist, and they give you a script, or they have a phlebotomist on site to draw the blood work. So when I say blood, I am referring to the liquid of the blood, which is the serum of the blood, red blood cells, white blood cells, and platelets. So when you go to your primary care doctor, you don't feel well, and they say, hey, let's do some blood work, they send you to LabCorp or Quest Diagnostics or AccuReference. These are conventional blood work. So they are testing and analyzing the liquid of the blood work. That is why sometimes a lot of conditions can be missed by looking at the liquid, because if you really want to know what's going on, the disease and dysfunction that is taking place, you need to check the cells of the blood work. You need to dig deeper and also do functional blood work. So I have an example here for you guys. So this is conventional blood work. This is a true patient. This is LabCorp. As you can tell, this patient, when he came to me, was complaining of fatigue, insomnia, problem sleeping, and the blood work was 100% normal. But the patient itself did not feel normal. That is why he was searching, and fortunately he found us, and I was able to run a conventional, functional blood work on him. So functional blood work assess and analyze the cells of the body. So when I said cells, think of your body as a factory, right? You have little workers, those are your cells, they go and work for you. So if you don't feed them the right nutrients, correct? If you don't give them enough water for them to stay hydrated, if you don't help them clean and remove toxins and heavy metals, then what's gonna happen over time, they're gonna be depleted, they're gonna get tired, they're gonna get inflamed, and they're gonna start shrinking and dying slowly. So that is why a functional blood work, which is the cells, right? Because when we say blood work, we're looking at the serum, red blood cells, and platelets. So functional blood work assess and analyze the cells of the blood work, and it is a true picture of your health, right? So I have an example here, and the company that we use in my practice called Genova. So then again, this is conventional blood work, where most often a lot of the values, the results are normal, right? You go to your doctor and they do the blood work and they say, hey, I'm sorry, your blood work is normal. But you keep searching and you still have the same symptoms, right? And the medications are probably not working. And sometimes the medications can create a lot more dysfunction than good, right? Over time, they can deplete your cells, right, of nutrients. So this is almost normal sometimes. And if this blood work, which is the conventional blood work from LabCorp, comes back abnormal, it's because there's a lot more disease or dysfunction taking place at the cellular level. Now it's spilling out into the serum and the liquid. Now the conventional laboratory is picking it up. For instance, let's talk about diabetes, right? So when you do a diabetes blood work, you're looking at your hemoglobin A1C. That is why you can categorize them into pre-diabetic, right? When the number is slightly going up, but you're not there yet, right? Or you can categorize a full-blown diabetes. That's when the hemoglobin A1C, which is the marker that we looked at to assess your nutritional value over a period of 3 months, is how bad it is. And then when that marker is very elevated, that's when the doctor needs to prescribe medications for you. However, if you're part of the wellness gala, we need to practice preventative care, right? We don't want it to be very, very bad and for us to treat it. We want to get to the root cause of the problem. We want to get to the underlying condition. We want to eliminate symptoms, and that is why every single human being, including like myself, should be doing a functional blood work at least once in the lifetime. And I'm going to show you why. So this is Genova, like I mentioned. Do you see? So with the functional blood work, we are assessing the cells of your body. You can see for sure that in this patient, which is same blood work, where everything is normal, but the patient has a lot of conditions: chronic fatigue, not able to sleep, a lot of brain fog, right, a lot of GI issues, gas bloating. So when I did this blood work, you can see all the red here. We use a traffic light system, right? And in this blood work, you're able to see his specific nutritional deficiencies, right? What am I lacking of? What are my cells telling me that they need? You can see for antioxidants. Antioxidants are the nutrients that we feed the cells for them to help us and boost our immune system, right? Because our immune system, our immune cells are our soldiers. They are our soldiers. They come out and fight for us. When you look at this, you can see this patient, which, I blacked the name, but you can see he's low in vitamin C. Now, this is not the serum. This is true picture of his health. We are looking at the cellular level. You can see he's low in vitamin C and alpha-lipoic acid, right? So when he looks at that, he knows for sure that he needs to increase his vitamin C supplementation, as well as take alpha-lipoic acid, which is an amino acid, to boost his immune system to protect him from viruses and infection. When you look at here too, you see the B vitamins. He has a lot of B deficiencies, right? That is why he's always tired and sluggish and brain fog and fatigue, because he needs all the B's. He needs B1, B2, B3, B5, B6, and B9 to produce energy, right? To help our cells to produce energy. He's also low as that. He also had back pain, a lot of muscle stiffness and achiness because his magnesium deficiency. He has no magnesium here. So do you see how this blood work is different? It is a true picture of your health. What I really love about this blood work, not only it tells you exactly your nutritional deficiencies, but it also gives you a lot of tips and tricks and what you can do to improve your diet to replenish the cells, right? So when you look in here, it goes into more details, right? Let's take glutathione, for instance. Glutathione is a master antioxidant. It is an amino acid. It is huge for liver detoxification. It's huge for cognitive function, right? It helps us with memory. It helps us with brain function. It helps us, have sharp brain. So when you have low glutathione and you're not ready to supplement, you can definitely look to see what kind of food you should be eating to increase your glutathione. And it tells you, that's how amazing this blood work is. It tells you exactly what it is, what our deficiencies are, and what we could be doing, what kind of activities that we are doing that could deplete those specific nutrients and vitamins, right? And it also tells you which food you should be eating. It tells you which food. For glutathione here, for him, he should be eating a lot of poultry, fish. He should be eating some nuts and some seeds, right? So it tells you a lot more details. It's very thorough. It is very comprehensive, and is a true picture of your health. However, when patients come to me and they said, I'm hearing about probiotic. Should I be taking a probiotic? And I'm not digesting my food. I have a lot of gas and discomfort in my stomach. I have bloating, and the food sits right here, and it's creating a lot of toxins and constipation. I said, well, let's take a look at the blood work, because this blood work also tells you your need for probiotic and also your need for digestive enzymes. So you can see right here, this patient, he needs probiotic. He also needs digestive enzymes. So when I'm recommending a supplement for a patient, when I'm recommending a healthy diet for a patient, I go back to this. This is my Bible, because I am replenishing the cells exactly what they need, right? So therefore, a patient like this who does a blood work like this will get better, faster, and quicker, because we're giving the body exactly what it needs. There's no guessing, right? I'm not, guessing and see what we should do this, we should do that. I'm always going back to what the body's asking for, to what the cells are in need, right? So with this blood as well, you're able to see energy, right? Most of us are tired, we are sluggish, we are dragging throughout the day. So when you do a blood work like this, it tells you how severe your energy production is, because it looks at the mitochondria, right? Mitochondria function, which is the energy, is an ATP production of energy. So when you have a blood work like this, it tells you exactly what kind of nutrients you need, what kind of vitamin you should be supplementing with to boost your mitochondria, your energy production, correct? It also tells you toxic exposure. Unfortunately, we live in a toxic world. It is our job to detoxify, to remove toxins as much as possible. So when you do blood work like this, it tells you exactly on a spectrum of no toxins to really a lot of toxins. And this patient falls like this. Because a lot of us have heavy metal, either from the food that we drink, the coffee that we drink, either from, the work that we did in our mouth, like root canal, dental work, right? So when we do something like this, it tells us exactly where to look at. It tells us exactly what we need to fix. But wait, functional blood work. So malabsorption, I mentioned earlier, this patient was complaining a lot of gas and bloating, a lot of food sitting right there in the stomach, and there was slow transit time, like he was having constipation, not going to the bathroom properly, which is part of elimination. So when I did this blood work, I can definitely see why, because he has markers for malabsorption. He's not absorbing his food. No wonder why he's tired all the time, because his cells are not getting the nutrients that they need for them to work and function optimally, right? So you do malabsorption here. He also had dysbiosis markers, like bacteria. He also had a bacterial infection in his gut. We have markers for that. We also have markers for yeast and fungal infections. This blood work is amazing. And I'm able to see, because he was pre-diabetic, I'm able to see how well he's digesting his carbohydrate. So when he eats a food that has high carbohydrate, pasta, bread, is he really digesting them? So when I look at this, you can tell with carbohydrate metabolism, he's in the red. So that's why he's pre-diabetic, because he's not absorbing his carbohydrate. A patient like that, I will give him, put him on an elimination diet. I will definitely start him on an antimicrobial herbs like oregano oil, and also change his diet so that his gut can absorb the food that he's eating. I will do some, carbohydrate elimination and embrace whole plant-based diet so that his body can absorb, so he can get some energy, so his brain fog can go away, so his joints can feel better, and his back can feel better. So this goes into energy production. Look at that. Energy production, energy metabolism, red, a lot of red, not good. He was always tired. Now when I look at a blood work like this, I can put a picture of his health together. I can put all the missing puzzles of his health together, because I can see why he's not absorbing his food, why he has malabsorption, and why he's not having enough energy, because he's not producing energy. So this right here tells you a lot. It goes into more details, right? Fatty acid, he needs omega-3 for brain function, and also for anti-inflammatory function for the joints, right? Omega for sex hormone production, omega-3s. He also needs a lot of neurotransmitters. He also had depression. He was taking depression medication, anxiety pills. I can see at his neurotransmitters. I can see at his dopamine, norepinephrine. I can see why he's coming up with all these complaints, right? So when I go back and look at this blood work, when I'm customizing, individualizing his protocol for him, this is where I'm going to get all my answers. This is where I'm going to go back and dig deeper, right? Become a medical investigator and address his health issues, right? Because conventional, right? Mostly always normal, unless you have diabetes, unless you have high cholesterol, this will come up in here, But if you're looking at the true picture of your body at the cellular level, you want to know exactly, why am I always sluggish? Why am I always tired? Why am I eating the right food? I'm not absorbing it. Why my stomach is always distended, right? Why am I not going to the bathroom properly? Why I feel so sick, but why, why all those things are not coming up? Why is my blood work is normal? Because we need to address, right? We need to dig deeper. We have to take a microscope and look at the cells, right, to see exactly what they need. Because our body is like a machine, right? We park it when we go to sleep. We put food, we put gas in our body, because food is fuel, food is medicine. So if you put in the right food in your body, or if you put in the right gas in your car, it should function optimally, right? But if you don't have the right cells, and if they're not getting fed with the right nutrients, right, you're not supporting the body, you're not removing toxins, you're not decreasing, helping the liver with detoxification, phase 1 and phase 2, and then you are going to have a lot of inflammation. You are going to have dysfunction in the body, because it is at the cellular level. So, but yes, this blood work is amazing. Toxins and detoxification process, these, you cannot get those results in a conventional blood work. Cannot. Why? Because when you do a functional blood work, it takes anywhere from 2 to 3 weeks, and you have to freeze the cells, right? You have to freeze them so that they can stay alive when you get to the laboratory. But when you do conventional, it's a different machine they use, a different techniques, right? They use to process this blood work than they do for this one. So you can see, this is a patient that came to us with a lot of common complaints that most of us experience, specifically fatigue, sluggishness, weight gain, right? Constipation, IBS, right? And this is the blood work. This is his blood work from conventional. When you look at something like this, you can definitely see why we're not getting to the root cause of the problem, right? Because everything is always normal, right? Normal. There's no dysfunction in here except for high cholesterol he had, and also even the heavy metal here was normal. But when you look at the heavy metal in this functional blood work, it's a different story. So that is why he was going to his doctors. Unfortunately, the doctors, the conventional doctors don't have the means to do functional blood work, and therefore they don't do it. But when you go to holistic, like us in this wonderful community, wellness practitioners, holistic nutritionists, functional medicine practitioners, we're able to really, really become a medical investigator and treat the problem at the root cause and the underlying condition and eliminate your symptoms. It is very possible. So amino acid, because we need protein for healing. It goes into, it's a lot of pages. Then again, it is a true picture of your health. It's like putting all the missing puzzles together so that your doctor can look at it and say, hey, we need to improve this area. Hey, we need to improve that area. And that is why, like I said earlier, that we all need to do a functional blood work, because it is very different. It is very, very, very different. Right? So there's some heavy metals in here as well. We have lead, mercury, arsenic, tin. And then you also have copper, magnesium, manganese, selenium. Right? This is a very true picture. It tells you about your liver detoxification, because the liver is like the garbage can of the body. Right? If the liver doesn't have the right antioxidant like milk thistle, the B vitamins, then you're going to have a lot of issues eliminating toxins from your liver. Now, if you have malabsorption, then again, you're not absorbing your food. You can be on the best diet on earth, you're still not absorbing your food. So it is very important that we fix those little issues so that you can regain your health and continue on your healing journey. So I hope you guys took some information. I hope it was informative for you guys. And I didn't go over too much of the medicine part of it, but I really, really wanted to come in here and see and tell you guys. So if it is very possible to heal the body naturally, and that's what all of us are doing here at the Wellness Gala platform, right? Thank you to Debbie Peterson. But to show you, when you've been to so many doctors, right, and you do all the conventional blood work and you see the cardiologist, nephrologist, sometimes we tend to lose hope, because all the blood work is coming back normal, right? Even if you have autoimmune, when it comes to autoimmune, there's a dysfunction. The autoimmune is looking for a lot of antioxidants to boost up the immune cells to work on your behalf, right? So it is there's a solution to every single problem out there. And like I mentioned earlier, I'm so honored and happy to present the two different blood work, and hopefully you can get some answers to your health issues, and then you can definitely go to a practitioner that is providing this blood work and really see which areas you can improve. It doesn't matter. You don't have to be sick to do this blood work, to be honest with you. If you're into health and wellness and you want to optimize your performance, you want to prevent diseases, or you want to be sharper, right? And even if you want to tailor your multivitamin supplements, right? You want to know which vitamins you should be taking, which one should you focus on. This is the blood work for you, because when you go buy your multivitamin, then you can look at the dosage and say, hey, I am low in B12, so therefore I'm going to look for vitamins that has methylcobalamin or hydroxycobalamin or adenosylcobalamin that has a lot of B12, right? When you choose your B complex, then you can say, hey, I'm low on B9, right? Like you can take a purchase one that has methylfolate or B6, because this is what we need for the body to work optimally. These are precursor to a lot of processes taking place in the body. Okay, so I'm not sure if you guys have any questions. I'm not able to see any questions, but if you do have any question, I would highly encourage that you write it below here, Wellness Gala on Facebook, or you can definitely go back to Wellness Gala Plus at wellnessgala.com. We have tons of wonderful practitioners there, and you'll definitely find someone to help you on your healing journey, to guide you, to give you the resources that you need to heal your body naturally. wellnessgala.com. Then again, my name is Dr. Jennifer Jeanty, functional medicine practitioner and the proud owner of Wellness Corner NJ. Thank you so much for being here. All right, good night, and I will see you over at wellnessgala.com. Thank you, and have a great evening.